Welcome to session 11 of Foundations in Global Health. In this session, we're going to talk about non communicable diseases. So, before we start our discussion on non communicable diseases, we need to define what an NCD is. An NCD is a chronic condition that does not result from an acute or infectious disease process, so hence it's a non communicable disease. It is a disease that has a prolonged course and is not resolved spontaneously. It usually has a complete or prolonged course. For example, mental well being is an NCD. And looking at this particular article that appeared in the World Economic Forum talking about mental well being um, has been an important issue given the current COVID pandemic that has been occurring for the past 2 years. This article talks about the mental health quotient or MHQ. And MHQ is a free and anonymous online assessment tool encompassing a comprehensive view of emotional, social, cognitive function, and capability. And in fact, MHQ was assessed um, in the first year during the Mental Health Million Project, and data was obtained from around 49,000 individuals from 8 English speaking countries. These included individuals from Singapore, United States, Canada, India, Australia, New Zealand, South Africa, and the United Kingdom. And as you can see from the results um, from 2019 compared to 2020, all the participants in this study showed that there was actually a decrease in MHQ from 2019. And in fact, the researchers noted that a greater incidence of lifetime traumas and adversities was systematically associated with lower mental health well being scores, pointing to the potential long term impact of these COVID 19 related changes. So, in fact, over the past at least several years, individuals have reported significantly lower mental health quotient associated with the traumas of COVID 19. Although COVID 19 is an infectious disease, it has had significant impact on non communicable conditions. For example, the previous slide shown that it has had an impact on mental health and mental well being in terms of mental health quotient based on the Sapient Lab analysis of 49,000 individuals in 8 English speaking countries. Moreover, uh, this result from earlier this year, actually from the Washington Post, which was published in July 21st of 2021, reported that there was an average of 1.5 years drop in the life expectancy of individuals living in the United States. And this was actually reflected in our data statistics and our mortality statistics. And by far, was the largest single year drop since World War II. And this reflects the pandemic's toll on the mortality and morbidity of people in the United States. And in fact, this was even more for Black and Brown people in the United States. Unfortunately, We're still in this pandemic. It is November 2021, and there's still significant vaccine hesitancy within the United States. Several lawmakers are still encouraging their constituents to get vaccinations. And remember, this is July of this year. So there is still some vaccine hesitation and hesitancy within the United States, which is unfortunate as people continue to die from this very preventable um, die of this disease. From the same time period, July 21st, 2021, as the Washington Post article, the New York Times article actually had this headline, which I think spells it out even more starkly, that uh, the plunge in the mortality statistics, even though it was 1.5 for the US as a whole, was actually worse for Hispanics and Black Americans. It was 2.9 years, basically 3 years, in terms of decrease in mortality. So it was twice that of that for Black and Brown individuals who for due to COVID since World War II. So that was the steepest decline in terms of mortality, which is significant. So unfortunately, the statistics bore this out. So this is what we talk about in terms of health disparities, the unequal access in terms of health disparities, in terms of that exist in America for Black and Brown, and also people around the globe in terms of vaccinations for um, access to vaccinations. And yet, there still seems to be a lot of vaccine skepticism around the globe in terms of these statistics, in terms of COVID. So it's unfortunate. And this image is just to remind everybody that that same time, July 21st, um, we had close to 200 million cases of COVID around the world. And we had 4 million deaths at that time compared to vaccinations. And at that time, the US was leading in terms of deaths and caseload for COVID, with India being second, Brazil being third, and Russia being fourth, with France being fifth. So the numbers have changed compared to where we're at now in November, but still, COVID is still a significant issue. And out of COVID, there are still non communicable diseases, including mental health. So even though hopefully by next year we'll be at the tail end of this pandemic, there are going to be non communicable disease related issues that are going to emerge from COVID that we will not probably understand for a long time. And they're going to have an effect for a significant part of the population. There are parts of the population now that are suffering with long COVID, and those issues are just starting to come to light. So, I personally believe that we're going to have the ramifications of COVID with us for a long time to come. Overall, although we have seen a steep 1 year decline in mortality due to COVID since World War II, the data is pretty clear. We have seen an increase in life expectancy since the 1800s. The interesting thing is that in the 1800s, basically everybody was equally in poor health. So the life expectancy in the 1800s was equally poor. So, for example, if you lived in India, your life expectancy was around 25 or so. And then, in China, maybe Russia, a little bit above 30 or so. But everybody was living maybe 25 to about maybe a little bit above 35 or so. However, when we moved from the 1800s to the 1950s, there was significant inequality in life expectancy. So, for example, if you were in India, your life expectancy changed from the mid 20s to the mid 30s. However, at the same time, your life expectancy, if you were in Germany, significantly improved from the mid um, 30s or so all the way past the 60s. This was quite a significant um, and interesting um, distribution and inequality in terms of industrialization, colonialism, and many significant factors that played into this. Now, since we've moved to the 2020s and 2021 with significant and more equality in terms of the global system with with the UN system and the creation of several global institutions, there is more greater equality and overall increase in the global life expectancy. Now, individuals that live in India, same, have significantly increased their life expectancy, um, and in Germany, those individuals also continue to increase their life expectancy. There is still some significant disparities. So, for example, individuals in Sierra Leone, Nigeria, Afghanistan, for example, their life expectancy are still significantly lower compared to individuals in Japan, Spain, South Korea, Costa Rica, and the US. However, um, there is an overall improvement in life expectancy compared to the 1950s. As you can see, countries with high expenditure on healthcare per person tend to have higher life expectancy. And looking at change over time, we see that countries spend more on health and life expectancy of the population increases. But as you can notice from this chart, there seems to be a pattern of diminishing return. That is simply stating that increases in life expectancy is associated with an increase in health expenditure, but that decreases as expenditure increases. So basically, this means that the proportional highest gains will be achieved in poor countries where the baseline level of spending is low. So this pattern is similarly observed between life expectancy and per capita income. So basically, you can do more if you spend more of your money in poorer countries where the baseline is less. At the global level, we see that the majority of deaths are basically caused by non-communicable diseases, which is indicated here in the blue. This chart is from 1990 to 2017, but it's the same for 2021. We basically see that over the past 30 years, injuries have stayed the same. The proportion of global mortality due to non-communicable diseases continue to increase, and it's over 73%. The proportion of global mortality, here in the red, due to communicable diseases, maternal, neonatal, and nutritional deaths, actually continues to decrease. And this is because there has been a lot of attention paid to nutritional, maternal, neonatal, uncommunicable diseases. And it includes HIV/AIDS, malaria, TB. There are global funds that we discussed in the section on UN and other global NGO partners that are dedicated to addressing these issues. And they are very important issues, but they have been successful in addressing those issues. However, the issues in terms of cardiovascular disease, hypertension, and many of these chronic diseases that contribute a lot to the global mortality are not given as much attention as they should be, coupled with the fact that there's an increase in life expectancy of individuals. So more people are going to be dying from chronic conditions, which are in the non-communicable diseases category. This data is provided by the Institute for Health Metrics and Evaluation and is the global burden of disease. And even though this data is from 2017, it's basically relevant to 2021. And in terms of deaths from diseases, um, mortality, cardiovascular diseases remain the number one cause of mortality globally, followed next by cancers. So both CVD and cancers cause around 27 to 28 million deaths globally, followed next by respiratory disorders. So the number one and two causes of deaths are both non-communicable diseases and cause more global mortality than communicable diseases or infectious diseases. And this has remained true beyond 2017 and will remain true post 2021. When we talk about non-communicable diseases, it's important that we understand two things. We have to talk about mortality versus risk factor. Mortality is basically the cause of death versus risk factor, which is associated with death. When we think about the epidemiological framework of the global burden of disease, we have to understand one thing. Each death has one specific cause. And in their words, each death is attributable to a single underlying cause. And that cause is what initiated the series of events leading to that death. This is different from the deaths that happen due to risk factors. These deaths are an estimation of the reduction of the number of deaths that would be achieved if the risk factors in which a population is exposed would be eliminated. For example, tobacco smoke, or reduction to the optimal health in the case of body mass index. So we can think of risk factors can be grouped into four broad categories. There are behavioral risk factors, there are environmental risk factors, there are occupational risk factors, and there are metabolic risk factors. All of these estimates are developed independently. This means that we cannot sum up all these attributable deaths and conclude that the actual number of deaths. And in fact, we understand that individuals have multiple risk factors, not just one risk factor. So, in fact, individuals could have a significant amount of risk factors that can predispose them toward mortality or morbidity. And not all risk factors actually lead to mortality. Some can dispose people toward morbidity, which includes just disability. So, there are several risk factors that are attributable to mortality that are measured across both age groups and both sexes. And this is taken from the IHME Global Burden of Disease data from 2017. But these risk factors are also very relevant for 2021. And in fact, you can see that the dominant risk factors are high blood pressure, smoking, and high blood glucose. But in fact, you can see that these risk factors are related to both dietary and active lifestyle factors. And then they segregate into smoking and air pollution as being prime risk factors for mortality. The three main risk factors that we're going to really explore are going to be actually smoking, high blood pressure, and high blood sugar, which affect around 23 million individuals if you combine based on 2017 statistics. Smoking is one of the leading risk factors for early mortality, according to global studies. And it's estimated about 8 million people die prematurely from smoking each year. About 15% of global deaths are attributable to smoking, and in some countries, it's more than 1 in 5 deaths. Smoking deaths typically affect older populations. More than half of all deaths occur in people over 70 years old, with 93% were over 50 years. Death rates from smoking have fallen in most countries in recent decades due to aggressive smoking cessation programs. 1 in 5 adults in the world smoke. However, the share of smokers have fallen. Interestingly, men are more likely to smoke than women, and this is probably a consequence of just the cultural acceptability of men smoking more so than women in most cultures. The share of adults who smoke is falling in most countries around the world, regardless of income level, and it has been found that taxing cigarettes and bans on advertising and support to help people quit smoking are all critical to accelerating the decline of smoking. When we look at the data based on men and women age 15 and older who smoke any tobacco products on a daily or non-daily basis, and this is data from the World Health Organization, we see that there are significant differences based on countries. We see that, for example, in the U.S., there are more tobacco users compared to Canada or Mexico. In Europe, in many European countries, there are differences in terms of tobacco utilization. Russia has a higher tobacco utilization compared to countries um, within in Europe and Asia. In Africa, again, there's some disparities and some differences, and also within Asia and also within also South America, there's some differences. When we also look at the data on men versus women smokers, the data is pretty clear. In almost all countries, except for two, um, most countries, men smokers outnumber women smokers. So the majority of smokers in almost all countries are men compared to women. The data is also pretty clear here. Since 1875, um, there was a steady increase in terms of the sale of cigarettes per day until around its peak in the 1960s or so. And then in the 1980s, there were starting to be 70s, it was the peak probably, and then it started going down in the 1980s, and then there has been a significant decrease in the 1990s and so forth. So there was the introduction of tobacco cessation and advertisement to reduce the utilization of tobacco, and that has resulted in decreases in the number of, and sale of cigarettes for adults in these countries. As you can see, um, by 2015, and many of these countries has also seen a significant decrease in the number of sales per cigarettes, even to 2021. Although the previous chart showed that there was a decrease in countries like Japan and other countries in the sale of cigarettes to adults per day, that has not been the case in all countries. So, for example, in Russia, even though there has been a decrease, the number that has decreased is still significantly more. There are more Russians smoking cigarettes per day compared to, for example, individuals in Japan or other countries. So, overall, even though the global level of cigarette utilization and tobacco utilization has decreased, there still are some differences in tobacco utilization from country to country. So, for example, in Russia, there's a more higher utilization compared to other countries, which is indicative of slide 14, which I showed that there's variability in tobacco utilization um, in terms of country to country. However, compared to several years ago, 20 years or 30 years ago, it's still significantly lower than it is now. Some of the key things that have led to decreased utilization of tobacco and decreased cigarette sales have been actually increases in taxation of cigarettes. So, for example, in Brazil, between 2006 and 2011, Brazil increased its cigarettes excise tax rates, leading real prices per pack of cigarettes to increase by 34% and consumption per adult to drop by 19%. And in 2012, a new mixed tax structure was introduced with increases in specific tax rates above expected inflation. Between 2012 and 2016, real prices increased by 33% and consumption per adult declined by almost 50%. Moreover, in the Russian Federation, um, they initiated an alcohol control measures, including banning advertising and restricting the ability and raising the cost of alcohol through taxes and minimum prices. By 2014, these measures had reduced alcohol consumption by one third and led to a substantial decline in NCDs and mortality. So, taxation has actually um, been a significant instrument that can drive down um, the consumption of both cigarettes and taxes and alcohol. So next, we're going to talk about high blood sugar and obesity and how that is a significant risk factor. And last, we'll talk about high blood pressure and how that is an important risk factor for cardiovascular disease. Obesity is one of the leading risk factors for premature mortality. It is linked to 4.7 million deaths globally in 2017. 8% of the global deaths were attributable to obesity. There are large differences in the rates of obesity across the world. For example, there are tenfold differences, as you can see here depicted on the right in terms of countries. In 2017, 13% of the adults in the world were obese, 39% were overweight. 1 in 5 children and adolescents were overweight. And obesity is basically determined by the balance of energy intake and expenditure. And rates of obesity have increased because we are consuming more calories because they have become more abundant due to just the abundance of processed foods and free and empty calories. Over the past century, but particularly over the past 50 years, the supply of calories has increased across the world. In the 1960s, the global average, or supply of calories, that is the availability of calories for consumers to eat, was around 2,200 kilocalories per person. But by 2013, this had increased to 2,800 kilocalories. Across most countries, energy consumption has therefore increased. If this increase is not met with an increase in energy expenditure, this will result in weight gain, and this will result in a rise in obesity. The most effective way to actually address the three risk factors, smoking, high blood sugar, high blood pressure, has been shown through taxes. The Healthy Taxes Save Lives 2019 report has actually done an analysis of utilizing taxes on sugary beverages, tobacco, and alcohol, and has done an analysis of how much revenue could be generated and how many lives could be gained um, in this respect. While tax on sugary beverages only affects a subset of products, um, tax on sugar and the diet will impact is still sufficient. Tax would could reduce sugary beverage consumption um, to lower population levels of obesity and adverse anywhere from zero point 0.8 to 2.2 million premature deaths over 50 years, and lowered and from the lower and higher tax increases respectively. Of course, this is a conservative estimate on the health impact to reduce sugary beverage consumption because it only captures the effect on health through increased body mass index and does not um, model other effects such as reductions in diabetes or from the same time frame for the same time frame sugary beverage taxes could contribute substantially to revenues in addition to zero point 0.7 to 1.4 trillion depending on the leverage of the tax increases. Now, when we look at tobacco, we can see that raising taxes on tobacco will save millions of lives. At the lower end, tax increases from 20% would avert over 10 million premature deaths during the next 50 years, gaining an estimated 212 million years of life, while raising over 1.6 trillion of additional revenue in present discounted value. Higher taxes that raise prices by 50% could avert over 27 million premature deaths and provide more than 535 million years of additional lives, while raising over 3 trillion in additional revenues worldwide over the next 50 years. To provide some perspective of these figures, if all countries raise the price of tobacco by 50% through tax increases, the number of deaths averted could be on par with eliminating all global cancer deaths for 3 years, which is about 8 million per year. Now let's look at alcohol. Increasing taxes on alcohol will avert 9 to 22 million premature deaths per year. Alcohol taxes can bring in the most additional revenue, in large part because alcohol taxes are currently low and consumption is widespread. Over 50 years, a tax that increases alcohol prices by 20% over current levels could generate an additional 9 trillion in additional revenue. For a 50% increase, that would present almost a 17 trillion in additional revenue, 3 times more than the BRICS country governments collect in revenue in 2017. So basically, taxing alcohol, tobacco, and sugary beverages, all three can bring in significant revenue, decrease consumption, and save significant lives, based on modeling from this report. So we've covered the risk factors for NCDs, but the interesting thing is we should discuss what Americans die from. So from the 2016 causes of death, most Americans die from usually heart disease, cardiovascular disease, NCDs, which aligns with the global trends. Next followed by cancer, which is 29.5%, road accidents at 7.6%, lower respiratory disease, and this is 2016 data. Of course, we know that the past 2 years have been an outlier in terms of COVID. So most people for the past 2 years are still dying from COVID just because of just the significant excess mortality due to COVID. But those 2 years are outliers. If we don't take those 2 years into account, the significant trend of NCDs still do exist. However, if we look at 2016 data, we see that in terms of Google search results, we see that in fact, most people don't search for heart disease, about 2%. More people search for cancer. Google search results, 37% search for cancers. Road traffic accidents are about 10%. A lot of people search for stroke, which is about 6.5%. Stroke was about 4.9%. Diabetes, which was 8.9%, and it's about 3.8%. Suicide, 12%, 1.8%, etc. here. And then we look at media coverage here, media coverage from The Guardian, 2016, media coverage here from the New York Times. And interestingly, media coverage, heart disease was very low at 2.5% and 2.1%, both in The Guardian and the New York Times, even though more Americans die from heart disease. And it's almost on par with cancer. But media coverage was dedicated more to cancer than heart disease. And in fact, media coverage was dedicated more toward terrorism, which, of course, when we see American dying deaths, terrorism, according to 2016, is not even amongst 1% of Americans die from terrorism. But Google search, 7% search for terrorism. And homicide, 3.2%. Media coverage for homicide was around 23% to 22%. And as you look at the top causes of death, homicide is not even 1% cause of deaths due to American. So, and then of course, suicide was 10%. Suicide is 1%, basically almost 2% towards American death rates here. So it actually reflects that what is generally covered in the media does not reflect what Americans die of. And in fact, what Americans' concerns are not really covered in terms of what is covered in the media also. So that's just an interesting difference in terms of what's covered in the media, what Americans truly are concerned about, and what the statistics say what Americans die from, at least in 2016. And I bet that same phenomenon is occurring in 2021. Previously, I've shown on the global level that the proportion of mortality due to infectious diseases have decreased over time, while the proportion of mortality due to non-communicable diseases is increasing over time. Because non-communicable diseases are diseases that progress over a long period of time, like cardiovascular disease or cancers, those diseases tend to occur in individuals who are older and tend to occur over a longer period of time. So what has occurred is that we're seeing that individuals that are under 5 mortality are actually decreasing. So we have basically around the globe have improved in terms of addressing under 5 mortality, neonatal deaths, and maternal deaths. We still have a long way to go, but we're doing a lot better job compared to 20 years ago. What we're seeing is now an increase in individuals who are in 60s or 70 years and above. Those individuals are again dying of non-communicable diseases, heart disease, cancers, etc. And that is because, again, there's a global increase in non-communicable disease. And that's where we're heading. Interestingly, in some populations, we're seeing that the rise in non-communicable diseases in some places is shifting toward an earlier age because of, again, obesity and some of the risk factors, smoking, high blood sugar, high blood pressure, and those things. And those are worrying trends that we're starting to see globally. In summary, the world is making progress against infectious diseases. As a consequence, more people are dying from non communicable, non infectious conditions. And in fact, that is what we're seeing globally for the past 20, 30 years. And that is going to continue in what we see in the future. The causes of death vary significantly between countries. However, non communicable diseases dominate in very high income countries, whereas infectious diseases dominate in many low and middle income countries. However, many low and middle income countries are transitioning to see to a point where they see high rates of non-communicable diseases. Cardiovascular diseases remain the leading cause of global mortality, followed by cancers. What we see is that uh, mostly mortality is due to non-NCDs in individuals that are in their 70s and above. The leading risk factors for global mortality, including smoking, high blood pressure, obesity, high blood sugar, and environmental risk factors, including air pollution. And then, of course, there are large differences in what people die from and what causes their deaths.